Hello, my name is Dr. Janet Diaz, and I'm the team lead for clinical management here in Geneva at the WHO. As we have already learned in Module 2, WHO has released a practical guide for UN country teams, the operational planning guidelines to support country preparedness and response. This guide is intended to provide immediate support to governments and partners in implementing their COVID-19 country-specific plan during the period up to April 30th. We have seen that the country guidelines are structured along 8 key pillars of the public health response with underlying actions for enhancing country preparedness and response. The focus today is Pillar 7, case management. With this video, we will detail the 3 levels of actions included within this pillar and describe what each implies. This is relevant at country or sub-country level for UN country teams, governments, and partners. The goal is that after this video, you are able to conduct your own assessment using the WHO online planning tool for COVID-19. In Module 2, we covered several high-level actions of Pillar 7. Healthcare facilities should prepare for large increases in the number of suspected cases of COVID-19. Staff should be familiar with the suspected COVID-19 case definition and be able to deliver the appropriate care pathway. Patients with or at risk of severe illness should be given priority over mild cases. A high volume of cases will put staff, facilities, and supplies under pressure. Guidance is available on how to manage mild cases in self-isolation. We recommend that plans to provide business continuity and provision of essential health services are reviewed. This includes special considerations and programs for vulnerable populations such as the elderly, patients with chronic diseases, pregnant and lactating women, and children. Let's now detail in each of these actions through 3 levels of prioritization. In the first level, we advise countries to map both vulnerable populations and health facilities and intensive care unit capacity. This includes traditional healers, pharmacies, and other public and private providers. It is also important to identify alternative facilities that may be used to provide COVID-19 treatment. Throughout the epidemic, countries are advised to continuously assess the burden on the local health system and capacity to safely deliver primary healthcare services. It will be important to ensure that guidance is disseminated for the self-care of patients with mild COVID-19 symptoms and when referral to healthcare facilities is recommended. In the second level, key actions include disseminating regularly updated information and training to medical and ambulatory teams in the management of severe acute respiratory infections and COVID-19 specific protocols. It is critical that the information on clinical operations is based on international standards and WHO clinical guidance. It is essential to set up triage and screening areas at all healthcare facilities. We recommend that countries establish dedicated and equipped teams and ambulances to transport suspected and confirmed cases and referral mechanisms for severe patients with comorbidities. Additionally, it is important to ensure comprehensive medical, nutritional, and psychosocial care for those with COVID-19. We recommend countries participate in clinical expert networks to aid in clinical characterization of COVID-19 infection, address challenges in clinical care, and foster global collaboration. The third level actions include preparing to implement diagnostics, therapeutics, and vaccines for compassionate use or clinical trials. This includes obtaining regulatory approval, market authorization, and/or post-market surveillance as appropriate. We recommend using WHO Global Clinical Data Platform and guidance on early investigations, the WHO R&D Master Clinical Trial Protocol, or the monitored emergency use of unregistered and investigational interventions. A first step to doing this is to designate a study sponsor in the country. Lastly, in all emergencies, we recommend that countries evaluate the implementation and effectiveness of case management interventions, address implementation gaps as necessary, and adjust guidance as new evidence emerges. Now that you have watched this video, you should be able to describe each key action in case management and be ready to assess whether each has already been or needs to be implemented at a country or sub-country level. It is important to keep in mind that the actions presented in this video are a guide and should not supersede existing national guidance and plans. It should be used to rapidly adapt existing relevant national plans and accelerate preparedness. For more information, you may access the Operational Planning Guidelines in the Additional Resources section of the training platform. Use the WHO online planning tool to begin the assessment. Thank you for watching the video.